Hello friends, let us now learn some important points about antidiuretics. So first, in the antidiuretics, we have antidiuretic hormone. First, we will learn about antidiuretic hormone. So first, in the antidiuretic hormone or vasopressin, this antidiuretic hormone or vasopressin mainly acts on three receptors: one V1 receptor, V2 receptor, and V3 receptor. It acts on V1 receptor and causes vasoconstriction. So because it causes vasoconstriction, it is used in the treatment of esophageal varices. So if you see the examples of the drugs, Desmopressin is non-specific and it has longer duration of action, which can be used for the treatment of esophageal varices. Similarly, we have the drug Terlipressin, which is a prodrug of vasopressin and can be preserved and is preferred for the treatment of esophageal varices. So for esophageal varices, we can use Desmopressin and Terlipressin. Then on V2 receptors, we have the action of antidiuresis, and it also causes release of factor 8 and von Willebrand factor. So in antidiuresis, it causes nocturnal, so it can be used in nocturnal enuresis. So because it causes antidiuresis, that is, it stops excess urination, so it can be used in nocturnal enuresis. Drug of choice for nocturnal enuresis is Desmopressin. Intranasal Desmopressin is not used. Previously, we used to use intranasal Desmopressin, but nowadays we are not using this intranasal Desmopressin because it can cause dilutional hyponatremia as a side effect. Then one more use of antidiuretic effect is in central diabetes insipidus. We will learn later. Second, it also causes release of factor 8 and von Willebrand factor, and thus it is used in hemophilia and von Willebrand disease. The drug which is used in hemophilia and von Willebrand disease is Desmopressin. Then we have V3 receptors, which are helpful in the release of ACTH. It is also V3 receptor is useful for release of ACTH, that is adrenocorticotropic hormone. Then we have, as I have said, it is also used through VT receptors. It causes antidiuresis, and thus it is used in central diabetes insipidus. So first we will learn some important points of how ADH is used in central diabetes insipidus. ADH is used previously in central diabetes insipidus, but it has not been used now because of the following limitations. Because it has shorter half-life. Because of this shorter half-life, we have to do repeated frequent dosing is necessary, and this is also non-specific. So because of its non-specific action, when this ADH activates V1 receptor, it causes vasoconstriction and thus increases BP. Then nowadays the drug of choice for central diabetes insipidus is Desmopressin, which is long acting and also selective V2 analog. This Desmopressin can be used either orally or nasally for central diabetes insipidus. Then if you see the side effects, antidiuretic hormone on contraction with on action on V1 receptors, it causes vasoconstriction and it can result in hypertension, and it can precipitate angina. So because it can precipitate angina, it is contraindicated in ischemic heart disease and hypertension. Then if there is intranasal Desmopressin can cause nasal irritation and rhinitis, and it also can cause dilutional hyponatremia as the side effect. So these are the important points about antidiuretic hormone and vasopressin. Now let us learn some important points about diabetes insipidus in the next class. Thank you for watching.